Hello, everybody. Sorry about that. The first 3 minutes I forgot to record. So my name's Seven Song, and I'm talking to you from upstate New York, Ithaca, New York. And today's class is on herbal consultations. And basically, the construct of today's class is not to discuss diagnosis, assessment, and treatment, but more to how to work, how to conduct, how to be a part of a consultation. And the reason I wanted to do this class is every week after I go to the clinic and the apprentices accompany me to the clinic, then following day, I ask them what they've learned in the clinic. And often what they say they've learned is things like how to interrupt a story or what to do during an awkward pause in a conversation or how to reinforce certain ideas uh, during a consultation. So that's really what this is. If you're interested in part one, I posted the link. It's on YouTube, and I posted the link on Instagram and Facebook. And so those are places you can find it. If you have questions, you're welcome to put them in the question box, the chat box. I'll try to answer some, but probably with the amount of information and the amount of rambling that I tend to do, I'm not sure how many I'll get, but I can also try to cover the questions at a different format or just cover them and then just post those. I would appreciate if people kept their questions relevant to the class. So for instance, if I talk about a specific herb, let's say licorice, I'm not going to really discuss anything about licorice as a medicine. I'm going to just be talking about it, in however it fits into the conversation. I wanted to say, just to make sure that this is clear, I'm not an herbalist as an alternative to conventional healthcare. So quickly, I don't really know what to call herbal medicine: holistic, unconventional, alternative. I don't really like any of those words. Traditional would be closer to what I would like for it. But actually, I don't practice as a traditional herbalist. I practice as a modern herbalist, using a lot of modern labs and talking to people on medications. But the reason I say that is that my consultation is not to move people away from pharmaceuticals or other medical treatments. That can enter the conversation if that's something they want to discuss, and it is something people often do want to discuss. But really, my specialty is herbal medicine, and so that's really how I want to address it. We'll talk about today bridging between herbal medicine and conventional. So those are terms I use. So for me, when I say conventional medicine, I mean the university-trained medicines that are common today: nurse practitioners, physician assistants, doctors, nurses. That's all I mean by conventional. The other, sometimes I'll call holistic, or just talk about what I do, which is herbal, which is sometimes holistic and sometimes not so holistic. All right, so there's the beginning. Next up, so last class, I stopped after discussing interrupting the story. This is also going to enter this idea of people talking a long time and how to get the relevant information from them is also going to enter into this next section that I'm about to cover, which is paraphrasing. So for a little bit now, I want to talk about paraphrasing. When I wrote my notes for this class, I wanted to do it, kind of bring up kind of semi-real situations that might show up for many of us when we're treating people. I've mentioned this previously. For some reason, when I talk to my laptop, my throat gets much drier than when I talk to a class or even an outdoor class. So I'm curious if that happens to you, if you're talking to your laptop, if somehow maybe the electrons are sucking the water molecules out of my throat. They are not. It is true that I need to drink more. All right. So paraphrasing. So paraphrasing, when you repeat what a patient, an individual, has told you in different words and often a much shorter summary. It's extremely important, but very important, to learn how to paraphrase in a consultation. The paraphrasing does a lot. So it's not just a matter of saying things back, I want to go over what it is, but I find that I paraphrase for, throughout consultations all the time. So first, it's a form of mirroring. So it allows the patient to know that you hear them. So they say, I have a headache and my legs hurt a lot and I have digestive problems. I'm writing some of this down. And I'll say, okay, so what I hear right now is that you have digestive problems and your legs hurt a lot and you have headaches. So I'm not going to do it all the time. That's patronizing and interfering. Um, but you do it every once in a while. And so one reason is just because the other person knows that you've listened to them. So as with every aspect of the consultation, though, it's not just a matter of words. We all know that we've spoken to people and they've been able to repeat back what we've said, but they didn't get the gist of it, right? So you'll say, are you listening to me? And also, yes, you just said this, but really, so they've memorized what you've said, but they haven't taken it in. So when you paraphrase and throughout the consultation, what's important really is your tone, how your voice sounds. Does it sound gruff and kind of accusatory, or does it sound like you're really listening? And also body language matters. So if you're not aware of it, I've talked about this previously, but while you're examining your patient's body language, they're looking at your body language. And so I don't think you have to be ultra uptight about it, but I certainly am not going to cross my arms and do kind of that chest hugging maneuver that often looks like you're being defensive or self-protective. And I'm going to be careful. Like the thing that I have to be careful of is I tend to put my finger in front of my mouth when I'm listening to people, but that's also the shush sign, right? So it's important that when you paraphrase and all other aspects of the consultation, the quality of your voice, the body language, and these other interpersonal aspects are important because you could paraphrase, oh, I hear you have a headache, and it's dismissive. Or you can say, what I'm hearing is that you have a headache, and that slight changes in the tone can make a difference. So again, so paraphrasing is a form of reflective listening. You're reflecting back, and also what's called mirroring. These are just the psychological terms for it. But another thing that paraphrasing does very well is it interrupts stories in order to gain the information that you want. So I wrote a story here. I'm going to read some of it, and I'm going to try to interrupt myself. So here it goes. So this is the patient talking to me. When I was 19 years old in 1985, I was bitten by a tick, and a few months later, I started having headaches and joint pain. I went to the doctor, who could not find anything wrong with me, gave me a prescription of steroids, and told me to avoid any strenuous exercise for a few weeks. A few years later, I was camping. So this is common. So the reason that this is common is herbalists are often generalists. So they're not just coming to me for knee pain, they're coming to me for a wide variety of pain. So they're going to start the story, which I talked about interrupting the story. What I want to talk about here is how paraphrasing does two things. It does interrupt the story, which has to happen at times. And also, it allows them to reflect on what they've said. So after I've read that, I read that fast because that's often how it goes. So at that point, I might say, okay, Sheila, what I heard from you is in 1985, you might have gotten Lyme, but there were no ticks, there were no tests at that point for Lyme and no medical treatment. And then I might say, this is the important part of the paraphrase, is how does that affect you today? The reason I'm doing this is because if they're going to go through the litany of things that happened since 1985 and the ways they've been dismissed by the medical community in all those years, it's going to take up the entire half hour. I understand why they want to do it. Somebody is listening. But for me, I need to know I have a certain amount of time, even though I work at a free clinic. They come back as often as they want, whether it's telehealth or in person. But I don't really need to know all that information. This is just honest from my point of view. So I understand many people got bit by ticks in the 70s and 80s, where there was almost no testing. Lyme disease was a questionable diagnosis, and medical treatment could be anything at that point, including just dismissive of the symptoms. But the other point, as we come in more, when we go into questions, is that I get to hear it. So when I say to them, okay, so I hear that you have headaches and joint pain since then. Do you still have those symptoms now? Often people will say, well, not really. Sometime in the 1990s, I started having these symptoms. And then I might say again, I hear that these symptoms happened in the 1990s. How about recently? The reason for all this is clear. I want to help them with what's going on in their body now. Some history is relevant. Knowing they've dismissed by the medical community, which happens often, is relevant, but not relevant in my treatment for them. So this little section about paraphrasing is important, again, because it does two things. It allows me to gain relevant information. It can help me from stopping a steamrolling story to bring it up to current where I can get the information. And then there's something that's really helpful when you paraphrase. And that is often people will say something different that's expected. So with the story I just said, I might say to the person, all right, Sheila, what it sounds to me is you had starting in the 80s, you've had all these pains and you have headaches and you've had a stiff neck and you've had a fever. Um, and let me bring it up. I'm going to change it a little bit. So I might say to them, so what I hear, Sheila, is that you have a headache and a stiff neck and your knees hurt a lot. And then they have an opportunity then to change the course of the conversation. Because I know they can say, well, not really. So I had all those symptoms a couple of years ago, but currently I have diarrhea and I have a really hard time sleeping. So when you say to them, when you say, okay, Sheila, what I hear is you have a lot of anxiety and you have really bad headaches. That gets them to hear that you're hearing them, but also allows them to change the story or to reiterate it. Go, exactly right. So, right now I can't fall asleep because I have really bad headaches and my anxiety just keeps me awake. This is bringing us up to date to allow us to help with treatment. Again, also, like I'm not a fast writer and I'm not a fast typist, and I don't type my notes. I type my notes after I see patients. We have electronic medical records at the free clinic. I work at the Ithaca Free Clinic, but I am much more comfortable writing notes. I'm quicker at it. I have better notation for it. Also, when I write notes, I feel like I can give the patient better direct eye contact and come up from my paper. I know that when I see medical people and they're typing the whole time I'm talking, I get very little eye contact with them. And I want some of that. I want them to stop for a minute and look at me. And I feel as I write on paper, but that's just me, that I can do that. The reason I'm talking about this during paraphrasing is it's a lot of notes, right? This person has just told me 6 or 7 health issues that they've had in the past few years. So I physically, I'm not sure that's the right word, I kind of have to stop them because I have to say, okay, what I hear so far is you have back pain and diarrhea and your mouth is dry. Is that correct? That also allows me just time to write this out. I mean, sometimes I do have to like say, excuse me a minute to get my notes written down because that's not my forte. I'm not strong. I'm not a shorthand writer. Um, but paraphrasing allows both an opportunity to catch up as well as getting better details of what's going on. And I guess just 1 or 2 more things. I hope this is making sense, right? For me, paraphrasing is like a keystone. Is that the right word? Paraphrasing during a consultation happens all the time. With some people, it's more important than others, especially if they kind of open up and a lot of information comes out at once. But remember that when you paraphrase, you're also saying, I'm listening to you, right? So you might need to interrupt the story. You might need it to gather more information. You might need it to bring it up to relevant status. And also, you're just saying, I hear this. This is what I hear. And they have a chance to correct it or say, that's correct, and then move forward. So I think that's it on paraphrasing. Yeah, I sometimes have to watch it. I don't know. The one thing that gets tricky, right? is I start to do this with my friends, right? And so they're telling a story and I want to paraphrase their story, but actually as a friend, not as a herbalist. My goal is to just listen to them. My goal is to listen, not always to, be in this role. So sometimes it takes a little while to move out of this role, especially running a school where I have to move out of the role of being a teacher, being a paraphrasing herbalist. All right, so I'm going to quickly check for any questions, and then I'm going to move on to the next section, which is about consultation questions. So let's see if there's any questions. All right. Michael asked, do you... So Michael asks, it's a good question. Um, so the question is, do I let people know? So before the consultation session begins, do I let people know that this might be a part of it? Me paraphrasing, me interrupting, or any of the aspects of a consultation? The answer is I don't. I I find that that would make it more awkward, rather, really. Um, what does happen though is when you can see when somebody's getting annoyed when you paraphrase, right? So it's kind of obvious sometimes that people want to tell their story and your paraphrasing is interrupting their story and they're getting frustrated because what they want to do is just spill out their story. And then you just have to make a choice, like what is better for the consultation, getting the information or allowing the person to run with their story. That's just a personal choice. All right. So this next one is about asking consultations. Excuse me, it's asking questions during the consultation. Uh, so having good questions, not really prepared questions, but there's a whole bunch of questions that are really helpful to ask during the course of a consultation. And so I want to go through some of these questions. Not all of them will fit into every situation. Um, but for me, asking the right kinds of questions is important. Once again, question asking, though, is very similar to paraphrasing or any other part. A lot of it is your tone and your body language. Tone is probably more important because you can ask a question in an accusatory way, or you can ask a question in a very open-ended way. So we're now going to move into that. I'm going to go with one more question here. Um, so I asked by Aiva, do I listen to the whole story? It just depends how long the story is. Um, yeah, no, I don't usually listen to, I'm reading a question and answering before I going into this next section. Um, I don't usually listen to the whole story and break it down. It's just too much information, and also I'll forget parts of it. So I will always stop it when I really need more information, and that's usually going to happen every couple of paragraphs or every couple of sentences. So the first aspects about asking consultation questions, the first thing that's probably really important and is true in all consultations, no matter what kind of practitioner you are, is to avoid asking leading questions. Again, this is psychological terminology, but a leading question would be, so do you get headaches whenever you go into your moldy apartment, right? It's possible, but a better question is, when do your headaches arise? Or when are your headaches most profound? You want to avoid these leading questions because first, what it's really setting up is for you to get the answer that you're looking for because a consultation is a hierarchical position. They've come to see you. And so within that dynamic, there's sometimes the people will acquiesce to how you phrase things. And also you're putting ideas in their head. So if they say, do you always get your headaches when you go into your moldy apartment? They might think yes, but actually it might be the wrong answer. They might have headaches that get worse when they go in their apartment, but actually their headaches happen because whatever reason, pollen in the air, stress at work, or the hundreds of things that cause headaches that nobody can ever figure out. So when you ask the leading question, when you ask a non-leading question, what's called an open-ended question, it gives them time to actually think about it. And sometimes it's kind of surprising. So for instance, often I'll talk to people and they'll say, let's say they have really bad digestion. And I'll say, when did your digestive problems begin? They say, oh, when I left home and went to college and had to eat dorm food or cafeteria food. Then sometimes I'll ask, again, open-ended, did these symptoms also happen before you went to college? And surprisingly, often people will say yes. So it could be because we as humans attach importance to memories that are stronger in us. So leaving home and going to college might be a very strong memory. And the years before that might be kind of fuddled into each other. So when somebody gives a strong, response saying, yeah, this happened when I went to college, a non-leading question is, did it happen beforehand? Right? Again, with a very open, expressive, questioning kind of tone. And again, often people say, well, really, yeah, I've had digestive problems a lot of my life. This matters as far as treatment, right? Because that is the goal. The goal is the person feels heard, and that you get the responses that you're looking for in order to facilitate whatever herbs or treatments you're going to offer them. There are times that leading questions are helpful because sometimes you're hearing something and the patient is not making a connection. So let's say they always get headaches when they go to Christmas dinner or some family affairs. So there is a chance that sometimes you're listening to people and you get to know them. And they're like, I don't know, I always get headaches. And then you say, well, it often seems when you get headaches when you go to these family events. So that is kind of a leading question, but the tone of voice also says, I'm not insisting that that is so. So that's the first part. How's this going? I hope I'm not talking too fast. I'm talking fairly New York bagel speed. I'm not really sure what bagel speed is. If it's Sunday morning in Long Island waiting online, it's slow. Next, again, asking open-ended questions. So when people first come to, they sit in the office, they're sitting in a chair, and generally, my initial questions are something like, how can I help you? Something really very vague and very open. For me, maybe you'll hear why I'm laughing. For me, often they don't know. So what's happened in the free clinic is they went to see a doctor. As they were checking out, they talked to the clinic coordinator. The clinic coordinator really likes me as an herbalist and will often recommend me and make an appointment for them. And so sometimes they're sitting there. This has to happen twice or three times a month. Somebody's sitting in the chair and I'll say, how can I help you? And they'll say, I don't know. Luz told me to see you. So Luz is the clinic coordinator for the Ithaca Free Clinic, which I'm really glad that our clinic coordinator likes herbs so much. So other questions are, where would you like to start? So what happens is that's the question that they'll have. We both sit down. How can I help you? Oh, I don't know where to start. Do you want all the information or do you just want what's happening now? This is up to you as a practitioner. For me, what I like is getting a sense of kind of a list of their health issues and then focusing it down on what I want to work with currently. So I might say to Sheila, okay, Sheila, what'll be helpful for me is let me know whatever your symptoms are, whatever your health issues are, and then let's move for the rest of the consultation to what's bothering you most. So what I'm writing down is I'll write that list. It might be 6 or 7 or 8 things or 3 or 4 things, whatever. And then I'll come back to, okay, so these are the things you told me. I'll often repeat them because they might want to add 1 or 2 more. Um, and then I'll say, what do you want to work on? I'll say, right now, diarrhea is the major consideration for me. And that's where you begin. Next, we talked a little bit about this last time, but I don't assume that patients understand much about their health condition, whether it's an autoimmune condition or fibromyalgia or cancer. Um, and so sometimes I ask questions to I want my questions to be within their understanding of their health condition. So if they come in with diabetes, I might not immediately go to like, what are your A1Cs or other labs for them? A1C is a lab that's taken to understand how much sugar has been in your blood for the past 3 months. In Canada, there's a different way of deciding that, different lab measurements. So I think it's just helpful to ask questions that you make sure they're within the understanding of their parameters of their health care. We'll come more into this when we talk about uh, bridging holistic and conventional medical care. Another question that I find helpful is asking people what concerns them about their health problem. This is not always true. I don't know if I would ask somebody who has like a stage 3 or 4 cancer. It's very obvious what it is, even though you might still get different responses. But sometimes, like they come in with a number of health conditions, which is very common. I have a sore, dry throat, my hair is falling out, I have diarrhea. And sometimes saying what concerns you about your health kind of gives you an insight into, into why they are concerned. And knowing that, I don't know, it gives me more clues into my treatment protocols. Also, I think it just bringing up that kind of fear, like what is happening, I think sometimes allows them to look at it. And also, sometimes you can say, well, those situations are less likely. They have eczema and they have a fear of something that is unlikely associated with eczema, and you're knowledgeable about eczema. You could discuss that with them. So, so that's another kind of question. So how do you feel about your health? Or even how do you feel about your general health? It's kind of amazing how often people will have a whole bunch of health problems. They have allergies, headaches, and their knees hurt. And I'll ask them, how do you feel about your health? They go, well, actually, I feel like my general health is good. And I don't think that's just a negative compartmentalization of their health issues. I think they actually feel pretty good, but these things are bringing them down. Where other people, when you say, how do you feel about your general health? They go, I feel shitty. I feel overall terrible. I'm tired all the time. I can't think very straight. My whole body is in pain. And so this just gives you other ideas, again, towards your treatment. That person might not just be the specifics, but you might be thinking about treating for anxiety or insomnia or anti-inflammatories rather than the specific condition they came in for. This next one is what I call the magic question. Um, and so I'm not much of a magic believer, though I do like sci-fi and fantasy books, and of course, Resident Alien. Um, but this is a question that I often ask when I'm unsure how to treat people, which is fairly regular. Later on, I'll talk about what to do when people have vague symptoms. This is going to be a little more specific. So it sounds like this. So somebody came in and they describe multiple health issues that they're having. They have, again, knee pain, shoulder pain, difficulty breathing. They have diarrhea. They're worried about slight tremors. Well, slight tremors becomes a red flag. And so this is the question. There's numerous ways to ask it that I ask frequently, and is If I could magically but realistically help you with one problem, how would you feel different? That's the question. If I treat you properly, if I give you the correct herbs, but really what I say is pretty, if I can kind of magically help you, but in a realistic way, what would be different? And often you get very succinct answers. I would not have diarrhea. I would wake up feeling refreshed. So it's not always exactly, I mean, just because you get a succinct answer does not mean that that's always the correct answer. You still want to go on. Um, but this is one of my favorite questions to ask. Um, for instance, if this treatment can change just one thing, what would it change? How would you look? How would you feel different? Now, of course, often it doesn't work. Many people will say, I don't know, I would feel better, which doesn't really help. But sometimes, and then I would stop the question. If the question seems antagonizing, right? Stop the question. So if that person's like, I don't know, that's a weird question, I would just feel better. And then I would say, okay. And then I would just proceed in a different line of questioning. But I would say 2/3 or some amount of time, people actually come up with, oh, I would get up better in the morning, my headaches would be gone. Because for them, they think, in their head, they're thinking, if actually they got better, what would they feel like? And that is really insightful. It's not the end all answer, right? So it is a magical thinking question, but I use it very frequently. So that is my magical question. Or really, it's if I treat you and it works, how would you feel? What would be different is really a better way of saying it. How would you feel is better. What would be different would be like, oh, I can eat any food I wanted, for instance. um, Sometimes when you're asking personal questions, it's helpful to let people know they don't have to answer them. For instance, if somebody has a lot of ongoing urinary tract infections, you may want to ask if their partner, if they've had sexual interactions with anybody, um, might have contributed to a urinary tract infection. But before I'd ask a question like that with like clear, you know, clear boundary pushing, at least in our culture, I would probably proceed it by saying, I'm about to ask you a few personal questions. You're welcome to not answer them. And they don't have to say no. Like if I ask them a personal question, if they're just quiet, I'll move on. Like I don't want them to feel cornered into like, okay, I want to share this. Because you can see whether by the way, if I'm going to ask that question, in my mind, I'm already judging if that's a reasonable question to ask. I'm not going to, if somebody has any kind of, I don't know, if their body is saying, don't ask personal questions, I'm not going to ask that question, even if it seems relevant. But what I'm saying is, once you move into personal questions, give them an out, kind of what Michael was saying in his question and their question, which is if you can set it up that people feel comfortable saying, I'd rather not answer that. It's frankly uncommon that they don't. Um, yeah. I want to mention something that happened. So I'm going off this questioning thing. I just want to mention something that happens in our clinic, just happened recently, that kind of fits in here. And it's probably not relevant for most people. So when I work at the Ithaca Free Clinic, I pretty much always have two apprentices, kind of students of another level with me in the clinic. The other day, somebody came in, and within a minute or two, I can see that they were really upset. And so I just asked the apprentices to leave the room. We've already practiced on how to leave the room being the least disruptive because it's a small room. So again, not really relevant to this questioning thing, but I just want to say that if you're like me and you invite people to listen into your consultations, by listening, I mean people that have been working with for a while, you should also have a way for them to leave because I could see that this person didn't want other people in the room. So I just asked them to leave. Yeah, later on I felt better. They came back in. All right. So back to the questions. Next, a really useful question is, have I forgotten to ask you anything? Or better yet, are there any questions that I should be asking? Because you don't know what you, maybe they have really bad headaches, maybe something's going on at home that they really, that wants to be a part of the discussion. So I think it could be really helpful to just ask that question. What else should I be asking? I don't ask it all the time, often because I run out of time at the end of 30 minutes, which is the normal amount of time I see people. So we keep going with some questions. Um, you might want to ask them um, obvious stuff. What medications that are they on? Even though there's a section for them to fill out for the free clinic, I might ask them that. But to stay more relevant to discussion, um, something that herbalists can ask is, what herbs have helped you previously and what herbs don't you like? Because often people will say something like valerian makes me agitated, chamomile I have allergies to, or I love chamomile. I mean, there's no reason not to give them herbs that have helped them previously. People take things and stop things, and sometimes there's no obvious reason. So, what herbs have been helpful for you? They go, oh, I really chamomile really helps me sleep, and then you could ask, would you like me to give you chamomile? Of course, so that, yeah. So that's another one. What herbs have been helpful for you? Sometimes when I get a little bit more into patient compliance a little bit, but sometimes um, when I ask questions that seem unrelated, I might describe to the person why I'm asking that question. So, for instance, somebody has a lot of inflammatory pain. They have a lot of shoulder pain, neck pain, just basically body aches and pains. I might ask them during the course of the consultation how well they sleep. The reason for that, first, it's helpful to know if people sleep well or not. But if you don't know this, probably we all do, but our body heals, and I mean that word heals here very specifically, better while you're sleeping than when you're awake. When you're awake, you're in a more sympathetic mode, and those molecules are not as good at healing things. When you go into a parasympathetic mode, let me be more specific. When you go into a parasympathetic mode, and your most parasympathetic mode is while you're sleeping, um, your blood has a better opportunity to move through all your tissues, which brings all those white blood cells and helps to clear the detritus that might be causing pain. Some people, of course, wake up with more pain because of the kind of arthritis or inflammatory conditions that they have. So when I ask somebody if they've slept well who's having inflammatory pain, part of it is if they're not sleeping well and tossing and turning, their body doesn't have as much opportunity to heal. So what makes it important in this aspect of asking questions is just letting them know, like, can I help you sleep better? And then just again bridging this and saying one of the reasons your body might be healing slower is because of your lack of sleeping deeply or your lack of sleeping well. This is really important. So the majority of people that I see at the free clinic have never seen an herbalist before. And so they don't like doctors may or may not ask these kinds of related questions or parallel questions. So when I say to them, the reason I'm asking you about sleep is because the relationship between sleep and inflammation is this. I tell them the relationship because I can see that they feel befuddled. Like, why is he asking me if I have diarrhea when I have headaches, right? Why are they asking me about hair loss if I have stress? And so it provides two things. It gives them an understanding of why you're asking the question, and also gives them some insights into possible causes of their health condition. And that's it about questions. Does anybody have any questions about these questions? I can try to answer one or two before moving on. And so Michelle asks, this is not about this specifically. Would you ask why they stopped using an herb that was helpful before? The answer is that's a great question, Michelle, and the answer is often yes. So when somebody says to me, I was taking chamomile and it really helped me sleep well, I might ask, why did you stop taking chamomile? Which could be insightful. So I think that's a really good question there. All right. So that takes us to our next section. Okay. And then we have one more question from Michael. Again, if people can keep their questions to just one or two sentences, it's much easier for me. Keep your questions like just one or two sentences. So Michael, your question will be answered in another section. I'm not going to bother going for it. But it's a good question. It'll be covered later, though. So this next aspect is about patient education. I feel one of the important things that herbalists can do is help our patients understand about herbs potentially, about their health condition, about what might cause their health condition. So what I'll spend a little bit of time discussing is patient education as far as the herbal consultation. Often education is a form of patient advocacy, really, right? Because when you help educate or teach, you're helping them understand, which helps them take control of their health in other ways. So here we go. So the first thing is this, I have to watch this a lot, is uh, there's a fine line between educating and over-informing. I am a teacher by nature. I am a blabbermouthy, chatterboxy human being who loves to tell people about why they have diabetes and what the inflammatory state and the difference between the sympathetic and the parasympathetic nervous systems. I am fascinated by that, but it's often really largely irrelevant. So, as I mentioned in the previous class, if you're talking a lot during a consultation, you might be doing something wrong. Your patient should be talking much more than you should be talking, right? This is not always true. There's no set rules in these things. But if you find that you're talking all the time, you really would be questioning, am I just filling in awkward silence? And is that a good idea? Or am I not allowing this person to express themselves who needs more time before they start to express themselves? Um, so when you're discussing something, so for me, something I do pretty regularly is discuss why diabetes hurts the human body. It's a fairly simple discussion, right? Sugar in the blood causes inflammation, then why it causes inflammation and problems around the eyes and kidneys particularly, and the feet. So while I'm trying to educate, while I'm trying to teach, I'm also being very aware of their body language, their facial expressions. Do they look interested, or do they not look interested? And also, am I cutting out time that could be better spent learning more about them? Uh, Hopefully, when you're seeing patients, clients, that you see them more than once. So over the course of time, you have an opportunity to discuss it because often the first time that you work with people, you're not really going to educate as much because you probably have less time because there's more input from them. Um, anyway, the main point here is be cautious about talking too much and over educating. And of course, use the language that they use. You know, if there's somebody who knows medical terminology, you use medical terminology. Many patients study their health issue and they might have an autoimmune condition and know about their autoantibodies and talk about their ANAs, and then you can go to there. And other people, it's going to be a different course of language, a different way of expressing it. Both are equally useful. So, and you can always ask, which I have to. So I'm describing, you know, what their A1Cs mean, and I can say, ask them, is this important to you? Does this interest you? And then watch their reaction. Not just listen, of course, but watch the reaction. Next thing we can do is we can help patients navigate the healthcare system. I am very fortunate, so I'm going to quick shout out, quick discussion. So I work at the Ithaca Free Clinic. You can look up the Ithaca Free Clinic, and it's a multimodality clinic And we have networking facilities there. We have a clinic coordinator. We have somebody who like facilitates helping people get on insurance. So I have other people, but sometimes I can talk to people and just help them make choices about, should they get labs for something, or I don't know, just how to navigate. It is a very complex area. Um, but just helping them. A kind of a weird one. I'll just suggest this. This doesn't have anything to do with the free clinic. But often I do healthcare at outdoor situations that are off the grid. And sometimes we send people to the hospital. And I let them know, this is going to sound weird. I let them know that if they dress nicer, they might get seen differently, right? So if they come in grubby, they might, I don't know. Unfortunately, in our world, presentation matters. So sometimes I discuss with the patient how they might want to present so they get taken more seriously. We would hope in a world of fairness that a presentation means nothing, but that is not the reality often. And sometimes the other part that I'll do is talk to them about the kinds of questions they can ask that will help them get better answers. And to avoid, I really feel it feels weird saying this, but to avoid antagonizing the medical people that they're going to interact with. For instance, I might say, don't bring up herbal medicine. As much as that hurts me to say, I don't really, it doesn't hurt me at all. It's such a common thing. But if they do that, they might be taken less seriously. So they go in and say, I've been having headaches and I've been taking feverfew. And that sets alarm bells off for some medical personnel. And then all of a sudden, their conversation switches. It might take them less seriously. So this is partly what I mean by navigating it. For things like insurance, I send them to an insurance facilitator, which there are. I mean, every company has an insurance facilitator, though some of them are hard sell people. You don't want that. Really, the best way to help with navigating the medical system is networking with other people. Again, I have an easier job with that because of where I work. Um, Next, so I'm going to move out of that. That's kind of a contentious area, but I'm saying it because I feel like this is true. Uh, Next is having brochures having brochures to give people. I have paper brochures, so I don't expect everybody to have access to computers. So I'm going to tell you some of the brochures that I have available. They're very simple to read. So the most important brochure that I give out, it's just a half piece of paper that says how they can get refills, who to call, what to say to lose. They're going to, who to email and what to say to get refills and how often they can get refills as often as they want. So it's a really helpful one for me because people often want to know how to get refills. By the way, a lot of the things I'm about to mention, I have brochures online. If you go to my website, sevensong.com, go to resources, go to handouts, go towards the bottom, you'll see brochures. You can take these, you could and configure them to work for you if you want. Other things that I have brochures about is general information about herbal medicine, like where I feel herbal medicine is helpful and not helpful or less helpful. And maybe how I practice as an herbalist and how you practice as an herbalist can be helpful. And then there's a lot of specifics. So I give a lot of hair rinses. There's many people I come in who are hair is falling out or they're concerned about their hair. And so I have a brochure on how to make hair rinses. Some of these, by the way, are in Spanish. I don't speak Spanish, but our clinic coordinator is fluent, was Spanish speaker. And so to make sure, because since I can't check them, I want to make sure that nothing weird gets into these brochures. But some of them, the common ones, are also in Spanish. I also have a brochure on how to use a French press, and I also have French presses to show people. So I was very fortunate. A couple of years ago, I asked people if they can presses to give a clinic. I got 50 French presses, and I'm down to 20, which is great. Still have plenty. And so, but I keep one because a lot of people don't know how to use this. And so I made a brochure on how to use a French press. It's just easy to use. Another one is how to make a compress. I don't give out that many compresses because they're more difficult, especially if you live alone. But that's another one. So those are just some of them. You can make as many as you want, but I only have like 4 or 5 uh, brochures or pieces of paper that describe things, with refills being the most helpful. The other thing in education um, is showing people again. I don't make tea in front of them, but I show them how to. No, I'll get a new French press. It's their French press, and I'll just show them. But also, one of the most important things that herbalists have to show people. Can you guess what it is? So what's the one thing, what's an expression you can type it in if you think it? When we give this certain preparation that we give to people and that our description of how to use it is different. Carrie, you can't answer this. It's different for each person. Yes, it's close. So not how to take a tincture, that's correct, but what is a dropper full, right? So we show them what is a dropper full. So for me, a dropper full is a full dropper, or to put it into milliliters, 2 milliliters, but I don't use milliliters. So what we do is when we give patients medicines, we'll go, it's usually the apprentice will show them, and they'll say what 7-Sol means by half dropper. This is hard to get, this one, the rubber's a little broken down. And so we show them, and then we'll say very clearly what I mean by a dropper full is really 2 half droppers. You don't have to follow this, but I'm suggesting, like I went to study with Michael Moore, and he called it a squirt. So very important herbalist in my life. But for many of my patients, a squirt is, you need to be a little more descriptive. Well, he described it, of course, in class. So when you say a dropper full, have a dropper with some fluid, or just show them and say, what I mean by dropper full is a full dropper. If you mean what comes over when you squeeze it a few times, say that. But that is really variable. In this particular one, the rubber is older and it's not filling as much as if the rubber was fresher, which means not really good, means it's an old medicine. I'm just keeping it for demonstration here. So what is a dropper full? Is pretty important. If they want to know why the herbs they're taking, if they want to know why they're taking the herbs they're taking, so why am I taking ginseng? Why am I taking OSHA? Why am I taking Elecampane? A few things come into consideration. The first is, how much do they know about herbs, right? For most people, it's a very simplistic answer. I am giving you OSHA for your sore throat. I'm giving you Elecampane because of your breathing difficulties, or it's an anti-inflammatory for the lungs. I am giving you Oregon grapefruit because it helps with the bacterial infection that you have in your body. I am giving lobelia because it can help with breathing. So for many people, that's enough. Frankly, it takes a long time to explain it, but that person can come back again if they want a more thorough explanation. As we all know, much of the information online is terrible, right? So speaking of hopefully not terrible information, I do want to, this is discussing it, but I'm hoping my herbal database, which I hope is not terrible at the least, is coming up, be a free online database. I'm announcing it because that's what I work on every day, but hopefully it starts in 2 weeks. It's only in the beginning, but hopefully it'll be helpful for people. But anyway, even with that, it's simplistic information. So sometimes you're the fount of knowledge for people. So they want to know why they're taking ginseng. They can look it up, and then they're going to have 1,000 reasons why they're taking it. And it doesn't really explain why you gave it to them. But I have to say that in my experience, most people don't really ask why they're taking any specific herbs. The majority of people, just are trusting or just want to take the herb. Or they might ask a specific question about when to take the herb, but not so much why the specific plants are in there. Next, in this question asking field, sometimes I want to explain how herbs are polarized in everywhere. So herbs are polarized, meaning there's this idea that herbs are old-fashioned and why bother, And then there's like herbs will cure everything. So it's kind of like what I think of, it's not so true anymore, but the Dr. Oz effect. So Dr. Oz, um, in the past, I really don't know if nobody's talking about him anymore in my clinic, but people would come in and go, I heard passion flower was good for, and I heard this is good for, and I can lose weight with this. And then I would have to explain that herbs are often polarized into being extraordinary healing, um, agents to, why bother? And of course, herbs are in the middle of it. Some herbs, very beneficial for some people some of the time. Some herbs are way over touted. So it's just something to consider with people. Just talking about the polarization. I don't know if I'd use that word, that how some people feel like exactly what I'm saying. That herbs lie in the middle of these two extremes of they cure everything and they're not useful at all or they're very dangerous. Other things that you can do um, is suggest books and resources. I don't do it that much. Uh, probably the most common resources I suggest are places where they can buy herbs online. I don't really want to go into that here. I don't really want to promote specific companies. I would suggest promoting people that you know well who make good medicines, with staying within affordability, of course, right? So somebody might make the best medicines, but if it's, $20, $25 an ounce, which I see all the time on Etsy, that's for many people, and with shipping, that's unaffordable. So then you have to figure out what's affordable within the purview of what is a good medicine. All right, we have about a half hour left. I'll take one of these kind of breaths. I'll take a sip of tea. I'll say once again, I turned 67 years old next Sunday, and there's no way I'm going to say 67 years young. I was definitely 67 years old, but glad to have the facilities that I still have. That is for sure. I think anyway, I'm not going to talk about age. Thank you. Um, let's see. So the next chapter here, how are people doing? Type in something quickly while I take a breath. Is this making sense? I'm not reading the questions. I just want to hear. This is giving some of the information you want. Yeah, I'm all airbrushed in over here. Hey there, Satya. So here we go. I find life ironic, by the way. Often I have these laughs. I feel bad, like in the clinic, I have to control it. But in my head, I'm always thinking of how everything feels ironic to me. Yes, yes, yes. Alanis Morissette, go Canadians. Um, but it's true. And so even teaching this, like I get bubbles of kind of weird, ironic laughter that constantly emerge from me. But without irony, I would be so effed. I mean, without thinking like, without irony, I don't know what I would think. All right, here it goes. Next, knowing medications and diseases. So this is a little bit tricky, but I want to talk about it because it's common. So the more you understand an individual's health conditions and the medications they're taking, the more confidence it can inspire in them. So I want to talk about this for a minute. So I've been studying since the 80s. I study pretty heavily. I forget twice as heavily as I study. So for instance, if somebody's going to discuss this, comes in and discusses cancer with me, so I just know the basics about cancer. I'm absolutely not a cancer specialist, but I understand the basics. And so when they're talking to me, and I can talk to them about what's happening in their body, it inspires confidence. Like all right, here's what I'm trying not to do. You should not try to study everything for everybody before you see them. It won't work unless you have some amazing memory. So before I go into this, here's how I want to say to do this. Study the things that come before you the most. I'm switching my tactic here. So if you see a lot of people with SIBO, if you see a lot of people with headaches, if you see a lot of people with arthritis, learn those conditions. Like you don't have to know the minutia. Your patient doesn't need to know which tumor necrosis factors are influencing their inflammation. They just need to know inflammation, right? So this is jumping to some autoimmune conditions. So it's helpful. I can see it, right? You kind of wish it isn't true, but when a person describes their health and the medications, and I know what they are, two things happen. The person feels more comfortable because they don't have to describe it, and they can see that I understand it. Plus, the consultation goes faster, right? Because I don't need to do a background check. Now, saying this, when somebody has like a list of drugs that they take, pharmaceuticals, I often don't know all of them, but I don't need to know all of them. I can look them up later, and I will look them up later, so that in the future when I talk to them, what I need to know is kind of if there's a medication affecting them currently. And I don't have a great memory, but I'm a reasonably good studier, and I could look stuff online. I don't usually do it unless it's really important. Generally, at this point, as an herbalist, when people come in and they have a condition I've never heard of, it's often uncommon, right? So they come in with some rare form of muscular dystrophy. This happened. And I've never heard of it, but they knew, it's very uncommon. So they would expect me not to know it. I'm not sure why I'm saying that. I'm just saying that sometimes I don't know it and I have to look it up. If it's rare, none of us will know it. I mean, unless we're doing like, we're the herbalist to rare conditions. So, and you can look it up. You can ask the patient to explain it, and then you can look it up later. But what I am suggesting here is studying after you see people. And there will be certain things like pretty much, I don't know, I can't imagine anybody here seeing people who don't have anxiety, autoimmune conditions, digestive problems, and some gynecological health issues, right? There's many more. So, you can look them up. And so I want to give some places where I do look some information up. For medications, there's lots of excellent resources. Wikipedia is not great on medications because they go into the minutia of it. And generally, you don't need to know exactly what chemicals are affecting what. But there's lots and lots of information on what a medication is. Usually, what you want to do is find the class of medication it is. And then you find out how that class interacts, whether it's an SSRI, a TNF inhibitor, tumor necrosis factor inhibitor, whatever the medication is. So all of this to say, before I go into these resources, is that it is helpful to understand it. Also just feels, I don't know, it builds personal confidence, but it makes the consultation go better for me. So for diseases, I like using osmosis, osmosis.org. I get none of these people paying, nobody pays me anything except my students at the school, and they're not paying me for these things. So in other words, these are just things I find useful. So for diseases, I like using osmosis. They have a lot of free videos online. So if somebody has a muscular dystrophy, I would just go YouTube, type osmosis and muscular dystrophy. There's a bunch of muscular dystrophies. It's a class. They also have a paid subscription, but I don't know if you need that or not. There's many other sources for them. Personally, I like it. So osmosis uses animations. So when I type in let's say I'm looking for muscular dystrophy and I go to YouTube, I'll type in muscular dystrophy animation because I learn well by both the visual and listening to it rather than just reading it. I'll often read it later. So, but that just depends on how, there's lots of lectures online. And if that's a better way for you to do it, and lots of people lectures on slideshows, lots and lots of experts, but people really knowledgeable online doing it. But that's the one I use. For anatomy, I'm a big fan of Sam Webster. All of this stuff is free on YouTube, Sam Webster. It's apparent that I'm a bit of an Anglophile. A lot of people English accents and UK accents. So I'm going to spend a moment on this. So Sam Webster uses models to describe stuff. And what I've started doing the past few years, and I started buying models and following along. So for instance, this is a pelvic floor. This model helped me so much to learn about the pelvic. There's lots of pelvic floor diseases that affect fertility, impotence, constipation. And so what I'll do, they're expensive. This is like $150. So I don't really know what it's something like that. It's just really, I tend to buy high-end ones because I expect to have them for a while. You could probably buy one lower end. It's also labeled. Anyway, what I'll do is that I'll watch Sam Webster or somebody else, and I'll just go through the parts with them a number of times. It really has helped me learn my anatomy. You can't see it, but I have a skeleton hanging behind me as well. Uh, so that's helped me learn the anatomy. But the pelvic floor one's been particularly helpful. I'm trying not to collect anything though. As people are dying around me and as I start to clean up people's family members' homes, I'm realizing like I don't want to have a lot of stuff so my family doesn't have to clean up my stuff. But the one thing that I haven't given up, I don't know why I'm going so morbid, is I can't resist getting the occasional anatomical model and going through them. I don't know what will happen to them. I'll have to put them somewhere, like where I will leave these. So yeah, I am morbid in that sense. I'm just thinking ahead, really. So I went really way off there. For physiology, I like osmosis again. And I also like zero to finals. You're going to find out once again that I like English sounding voices or UK sounding voices. But there's many other ones. I find the zero to finals a useful physiology tool. And there's a guy, I forget his name, Armand Hardmanson. I can't remember. Armand is his first name. And he does one of the hand-drawn ones. It's actually his hand. And I find his really useful. I find his definitions really useful. So these are some for physiology. The one thing I would say, if you're trying to learn about a drug, avoid the drug company. It's going to be extremely biased. So if I'm learning what Xanax does, I don't know who makes Xanax, but I'm certainly not going to go to the Xanax website. That's going to be very biased. I'm going to look elsewhere. Let me see if there's any questions about this. Oh, Carrie's giving osmosis. By the way, so Carrie, who I see in the left-hand corner, Carrie Nader, Nader, Carrie's an herbalist who's been very helpful here, and she's an herbalist in Buffalo, New York. So if you're interested, if you live around the Buffalo, New York area, I am suggesting Carrie. Uh, so Laura, I think I'm gonna. His name is something like Armond, and then his last name starts with an H, and I'm not. And then it has like a bunch of letters. I just don't know it. I should learn it. But I find I really like his hand-drawn stuff. And Carrie's helping me. So um, a few questions before we move on. We have about 15 minutes left. Oh, so Danny got it. Armando. Yeah, I got that entirely wrong. Thank you very much, Danny. I don't know how to say his last name, but that's exactly who it is. For all these people, a lot of them have old ones and new ones. Look for their new ones, right? Like, for instance, Sam Webster did a bunch of ones, and then he redid them with better lighting and better sound. So I would just, if you're looking up something, look up the newer ones. But he's strictly anatomy. All right. So are my teas medicinal? These are questions. Are my teas medicinal dosages? The teas, I don't know what a medicinal dosage is. The teas are medicinal dosages within reasonable amounts that, yeah, the teas are medicinal dosages would be the easy answer, I think. Next question is, how do I handle writing, communicating possible precautions and interactions? That's a discussion with the individual patient. So if they're on, like I recently had a patient on many, many medications, more than usual. I'm not anti-pharmaceutical, but she was on many medications of many different classes. So that matters, right? She's just on one class of medication. I could have said, okay, how can we avoid it? But she was probably on like 6 classes of medications, maybe 5. And so when we talked about herbs, I just had to describe what the possibilities of interactions might be without going into detail, because this person doesn't really know anything about herbal medicine. All right. So we'll probably end on this one. I might try, sorry to keep doing this. I might try to have one more after this to finish this up, and it probably won't be as long because I don't want to rush through it. Um, so here's the next one, which will probably take us to it, and then I'll probably do one more based mostly on patient compliance because I'm going to stop at 2:30. So this next one I'm calling working with complex situations. So it's not about diagnosis or treatment. It's just about all the weirdness that can occur during a consultation. I got a lot of these. I wrote to my apprentices and said, "What are things that you've learned?" And this set is like, this is what we've seen at the clinic. So the first one, actually, Michael asked this previously, is what to do when people have unrealistic expectations about herbal medicine. Oof. So the first thing is don't feed it, right? There's all of us are falling apart. I'm sorry, I'm so negative, but all of us will have things that fall apart, right? We are made up of trillions of cells. Sometimes they work beautifully together. Some people's bodies just work really great all the time, but really most people's bodies, something is not working great, your digestive system or your joints, whatever. So, um, and so sometimes people, so there's a bunch of things. So this is what to do when people have unrealistic expectations. Um, I didn't write any, what do I do here? Um, I just explained that that's not how it works. I'm saying in a kind of cruder way that I might. So here's one that happens. People come in with some kind of cancer, maybe a stage 3 cancer, depending what kind of cancer, and they'll say, I've heard that astragalus and reishi mushrooms can help. And what I'll say is it's not clear that, for instance, astragalus and reishi mushrooms or whatever herbs they're mentioning are going to stop tumor cells from growing. Depending on the level of the person's understanding is the level that I'll discuss it. What I will say, and this is really frequent, is what herbs can do. So I do see people with cancer. I am not an herbalist who specializes in cancer. There are a few herbalists that do so. And so when they come in and say, I have, this kind of cancer, I know enough to know like what the next stages will be medically or what stages they're going through medically. And then I'll say, what we can do is support you. So that's a kind of straightforward one. Um, so that, can we help with sleep? Can we help with pain? Can we help with anxiety? Can we help increase immunity? Do you want to increase immunity? Are they on chemo? How will herbs affect their chemo? So the first thing is bringing it down to the reality of what we can do. And letting people know that there's no magic bullets. There's only, it's so negative to say, but there's only one thing that cures all disease, and that is death, right? Otherwise, we can all look forward to having to learning about our bodies and treating our bodies. I don't say that. I don't really bring up death very much with patients. It's not a very positive thing when somebody's coming to see you for their health needs. But I'm just saying, like the reality is, often people will struggle. And I just want to be realistic in what I feel like herbal medicine can provide from them. Also, I'm going to try to help them if they need a medical evaluation. This happens too. Like they don't want to get a medical evaluation. And I understand why, because it goes down that slippery slope, right? So you go in because you're having heart palpitations, and then you're going to the nephrologist for your kidneys, and then you're going to another doctor to get your levels checked of something else. And it's scary. It is very truly scary that once you go in for one thing, often it starts it. But sometimes you need it. Like if somebody comes in and says, my hair is falling out and I'm cold all the time and I'm gaining weight mostly around my rib section and I'm eating less, then you just want to check your thyroid. Usually that one's a little simpler. That doesn't usually lead into everything else. Um, but understanding, those symptoms can be helpful. You understand those symptoms and knowing what potential medical evaluations they need or maybe not need. Um, I'm getting past myself. Really, what I want to say is there's no herbs that cure everything. Sometimes some herbs do work very special. Somebody can't sleep, and for chamomile is the thing that helps them sleep. Um, but when people come in and they'll say, "Oh, I've heard that feverfew helps headaches," feverfew helps some people with some headaches. It does not cure everybody's headaches. And even then, sometimes people build up tolerance. So it's amazing. Feverfew does stop their headaches for a couple of weeks and then they can come back. I don't want to set up false expectations because I want that person to feel comfortable coming back to me. And by realistic, I feel like the chances are better that if the feverfew stops working, then we can try something else. There's hundreds of herbs. I have hundreds of herbs at the clinic that we can keep trying them. Um, the next one is what to do when the symptoms are vague. This could be frustrating. So somebody comes in and they start saying, my stomach doesn't feel good. I feel like I have some blurry vision. When I get up in the morning, my joints hurt. Um, and sometimes I don't know. Sometimes I just don't feel good. And then you ask them, you might paraphrase. You say, what I hear is that, your knees, I'm not going to be exactly sure what I just said. Your knees hurt, your digestive system doesn't feel well. Is that right? They go, well, also, I just kind of don't feel good in my body. And it keeps going on. So each time I paraphrase and say, what I hear from you is that you're tired all the time and you have headaches and digestive problems. I go, yeah, but it's more than that. This can go on the whole time. So what happens, like there are some people that cannot be pinned down to a health problem. That's okay. It just it makes treatment more difficult because to them, they have vague symptoms. And so they're reiterating their vague symptoms. I will try to pinpoint it I don't need to pinpoint. I just want to know their symptoms or what's most important to them. Is better sleep the most important thing? But I will say from experience that I can spend a half hour and 45 minutes with people and really they leave and I have no idea what they have come in for. I have lots of notes, but there's nothing specific. What I can do, if I feel it's appropriate, is make them a medicine for what I think seems most important to me. I can ask beforehand, say, it seems like the headaches are important. Let's give you something for your headaches. And even if they stay vague, I want to give them something that makes them feel like they've been acknowledged that they're there. And so I'm just going to try to give them an herb. Often it's not going to be very strong because I'm not sure what's really going on in their body. Um, but I don't know. And you can say this has happened to me as a clinician if it's happened to you in the chat box, where you spend a long time with somebody and they leave and you really still don't know what is wrong with them. Um, yeah, that, yeah, it's just going to happen. Um, Working with very anxious people. So one thing, if people are very anxious, is to keep yourself centered, right? All you first aid workers, midwives, any, people who are used to need to be centered a lot, do that so that you don't promote more anxiety, even as their anxiety levels might rise as they describe it. You can ask people to take a deep breath. I'm pretty cautious about that. Asking people to take a deep breath could be patronizing, right? So I just want to be careful about that. I can say, it seems like you're really anxious. Should we continue talking like this? In other words, just being real. Like, is this making you anxious? Is there something I can do to reduce this? Um, but one thing you can definitely do is you can stay centered. I would say don't take obvious deep breaths. I find that patronizing. You do that in front of them. It's a signal. It depends. I mean, if I'm with a friend, anyway, I am cautious about that. One thing that could be helpful is using people's names. You don't want to overuse their names, but it brings people back. So, Sheila, I hear that you're really anxious. Is there anything I can help you? And then using their name a few times. When you use a person's name, in your certain positive tone of voice, it centers people and helps them feel it helps them feel heard and comfortable. But there are people. I have one patient. They must use my name like 3 times per sentence. So Seven Song, when I'm having trouble with Seven Song, there's this thing Seven Song. So I don't say anything because I it's not a problem for me. But I don't want to repeat that back to people. But when I leave, I just hear my name in my head for a long period of time. Um, So, and if they're anxious, treatment in anxiety is finding out what anxiety means to them, because anxiety means different things to different people. Um, Next, what to do when you don't know any herbs for their conditions. This happens. This is different than having people have unrealistic expectations. So they'll come in and they'll say, well, let's go with muscular dystrophy. So there's no herbs that I know that will stop the genetic predisposition of muscles breaking down during certain kinds of muscular dystrophies. You can help the person in numerous ways, but I don't know herbs that stop that congenital or genetic problem. So people who have these issues, there's a lot they can do. A lot of it is strength. There's a lot to do. It's not my specialty at all. I'm definitely going to recommend out. But I don't want them to think that there's an herb that's going to stop this health issue. What I do want them to know, just like I talked about with cancer, is we can do a lot to support them. We can give them nourishing tonics. We can make suggestions for other practitioners. So you have to be clear and honest. Like, I don't know any herbs that help this specific condition, but I'm here for you. And what can we do? What can I do to help you with this? Again, not setting up unrealistic expectations. Just a few more moments and we'll stop. And what Carrie's going to do is before she leaves in a few minutes, she can send me a list of questions and I can try to answer them separately. So I can just finish up this section. Lately, this has just been weird. I have been having so many people that have asked me herbs for motivation. And I don't know any herbs for motivation. I don't know what to call it. It's a psychological issue or motivation, I don't mean to put it down. I mean that motivation, if somebody says what herbs are good for motivation, I want to know what they mean. Like, are they tired? Do they have trouble with concentration? Do they have trouble getting out of bed? So with this, because the past couple of months, I've just had numerous people, and I understand that their desire to be more motivated. I mean, do they want herbs like rhodiola that are stimulating, right? So what does motivation mean to them? And so I think asking what does motivation mean is not as helpful as asking, do you want herbs that help you relax? Do you want herbs do you have some pain that's decreasing your motivation? Do you have life situations? And I'm not really sure, you know, I just, again, I don't know if there's any specific herbs. This is what I'm talking to them. I don't know if there's any specific herbs for motivation, but I'm here to help. What can I do to help? What are the herbs? What else can we work with that might help you feel more motivated? Um, I'm going to stop at this last one, and then I'll just spend another moment kind of filling in the last moment or two. What to do when you disagree with a patient's diagnosis or treatment? I should probably start this next one as well. So sometimes people actually, I think I'm just going to answer this. I'm going to start. I'm going to do one more of this series, and I'm going to start with that question. It's a very complex question of what to do when you disagree with somebody. So instead, I'm going to look at some of these questions and see if I could answer them. So if you have any questions for today, we only have 3 minutes, and I don't want to start something new. And Danny, I agree with Danny. Death is the universal panacea. It's sad and true about a girl that I once knew. Sorry. That was showing my age, that song. It's true. And so Laura says the type of patient with vague presentations may also shop around for healthcare providers. That's often true. So let me say something about this. This might be helpful as a kind of a last minute thing. I am really careful not to put down other herbalists, sometimes, or other medical practitioners. This is different than people saying they've been depersonalized. So sometimes people will come in and say, "Oh, I saw this other herbalist in town," and they'll come in. This kind of goes with Laura's point about shopping for practitioners. People will come in and say, "I saw this person, I took their herbs, and it made me worse." And then they might say, "And I didn't like this about them." I don't feed that. There's a couple of reasons. One reason is you're next, right? If you think that you're going to be the person that's the end of the line, you're wrong. You're right. They're probably, if they still have symptoms, they're going to tell the next herb. But I don't want to feed this pattern of putting down other herbalists, even medical practitioners. But this is different than people feeling depersonalized by the medical system. So when they come in and they go, every doctor doesn't believe me with my symptoms, or everybody just wants to give me an SSRI, an antidepressant, I will talk to them about that a little bit at least, because that's not about a specific practitioner. That's about a practice that's really common. So I hope that that makes sense. So I hope that today was useful. This will probably in 2 Sundays from now, I'll probably continue this. I can look for one or two more questions. But you might notice I like to really begin on time and go on time. And yes, so Danny mentions there's no herb that's cure for loss or futility. That's correct. There's lots of herbs that support us, but they're very individual. Michael, how do we support nocebos? Um, I'm gonna have to skip that one for now. All right, I think I'll just stop. Well, it's 2:30. I really appreciate people being here. I know there's other airlines you can fly. I know there's other things to do on Sundays. And I am recording this, but I really like it when I said in the beginning that it's weird to talk to a computer screen. It's weirder for me when there's nobody on the computer screen. I haven't set myself up for that yet. So I'll see you later, everybody. I hope this information is useful. Please let me know. I like the positive feedback, but I'm also open to other things. If there's something you feel like non-specific that you feel like, or specific that you feel like would be helpful for this. So I'm going to stop the recording. I'm going to read these messages scrolling on the right side for a little while because they're awesome, positive and uplifting for me, but they could be anything. This is an open forum. It's a closed forum, but I'll read your information. All right, I'm rambling. Bye, everybody.